Howdy YouTube family, it's Bold CRNA coming to you again with another day's topic. So today I'm going to be reacting to anesthesia memes that are funny online. Some of them have a little bit of truth behind them and some of them are just fictional. So we'll dive into those today. So this first one is kind of funny. It's Keanu Reeves back in the 90s, it looks like, and he's saying, what if anesthesia doesn't actually block the pain, but only makes you forget about it after the operation's over? That is kind of a scary thing that a lot of people have the fear of, is that anesthesia is actually, they're going to wake up in the middle of the procedure, or they're going to be in pain during the procedure, things like that. There's a lot of the fear of the unknown. And so with anesthesia, funny thing is we do actually give a medication called Versed, which does have amnesia effects to it. So if we give you Versed and you did happen to wake up or something was unpleasant at some point during the procedure, chances are you're not going to really remember it. This next one is classic. It's the doesnt commercial. This one says, I don't always blame anesthesia, but when I do, I make sure they're not in front of me. That is so true, although sometimes we are right in front of you and you still blame us. So it's no shade on your part, because some of you are bold enough to just straight up blame us right to our faces. But it's just a big cosmic joke that we have in the healthcare field, is that everyone blames anesthesia for everything, and it's true. They kind of do blame us for everything, but it's okay. We take it in stride. We kick back in our chair behind the drapes and we just enjoy our day. All the 300 memes saying, say anesthesia delay one more time. So that is definitely a callback to how there's a time schedule for the OR and everybody is trying to get, like if the case is scheduled to start at 8 o'clock on the dot, everybody from the circulator nurse to the CRNA / physician anesthesiologist, whoever's doing the anesthesia case, to the surgeon, to the OR board runner, whoever that is, everybody's trying to organize this to happen at 8 o'clock on the dot. And if for some reason it happens at like 8:05, somebody is going to be figuring out who caused that delay. And if it turns out to be anesthesia, then you kind of get dinged for that. This one cracks me up. It says Anesthesia Kit says take deep breaths and count backwards. That is so funny, because right before people go to sleep, after we give them pre-oxygenation and I'm giving my induction meds and stuff, they're staring up at me, and I usually have like some kind of hat of some sort on, like we have to have back in the OR. And I always wonder what I must look like to them from that perspective, turned upside down, laying down, with anesthesia meds running through their system. And I'm telling them, take deep breaths and all that, and they're about to go to sleep. So hopefully I don't quite look like that, but I guess it would be kind of cute if I did. Oh, the classic Michael Jackson meme where he's eating popcorn and looking at the tea being spilt. So he says, when the surgeon's arguing with anesthesia and you in the middle, like, yeah, that's definitely like the scrub techs and the circulators and pretty much everyone else in the room that's assisting. With surgical case, there's always anesthesia over here and there's a surgeon over here, and we're on two different sides of the drape. And we have to deal with like the heart and the lungs and the body, and making sure they're pain-free and making sure they're safe and alive, and all those things that we need to do for them to get through the procedure and safely come out on the other end. And then the surgeons on this side with their perspective of, I need to get this surgical procedure fixed or done, whatever is wrong with this patient that I need to do to fix it. That's what I'm focusing on. So you both have to work together, and sometimes you have a difference of opinion on what the right choice is to do or what's the safest thing to do. And 95% of the time I'll say that you come together and professionally agree, and you say this is the right choice, and you head to that direction together. Occasionally, that 5% of the time, there is a disagreement, and so sometimes I guess scrub techs and stuff in the room are just kicked back, like enjoying the show. But it's all for the patient's safety. Oh, the baby Yoda. I love baby Yoda. This little guy is saying, me, an SRNA, waiting to ask the anesthesia provider if I can pee. That is so accurate. I was an SRNA for 3 years, and that was not long ago for me. I still remember it pretty well. And you definitely are like this little tiny thing that feels like meek and humble and afraid to ask anyone anything in the room. You're afraid to be a nuisance. You're afraid to say, hey, I drank like a liter of water this morning and I haven't peed in 5 hours and we're still going in this case and I'm like about to explode, and you're just like desperate that the case is going to end or that the CRNA is going to say like, hey, do you need to take a bathroom break? A lot of times they will ask you if you need to after a few hours, but there are some times where they just totally forget or don't care, and you have to like beg them, like, please let me go to the bathroom. Oh, another meme about the relationship between surgeons and anesthesia. It says, an anesthetic guide to surgical crises. You peek over the drapes, and is your surgeon grumpy, which means everything's good, everything's sweet, or if they're bloody and grumpy, that means something's gone wrong. So it's poking fun that surgeons are always grumpy. They're not always grumpy, but if you do look over the drapes and they're grumpy and bloody, then that is your quick signal like something's gone wrong, you need to investigate. Oh, Captain Picard, classic Star Trek meme here. It says, just because he moves a little doesn't mean he's awake. And that is the eternal struggle of anesthesia. Is we sometimes do paralytic occasionally, other times we don't do paralytic if it's not appropriate. There's a lot of different nuances to what we do and why we do them in anesthesia. But surgeons and the rest of the surgical team may not understand those things because they're not trained in anesthesia. So they may not understand why you didn't use paralytic, or why you're not redosing a ton more of paralytic, or how sometimes paralytic, doesn't 100% block every movement that the patient has, for hours. Eventually they will move a little bit again. So there's just nuances to it, and you definitely get into that discussion with surgeons sometimes, like if there's a little bit of a movement or a slight twitch or anything like that, that doesn't mean that they're awake and that you are not giving anesthesia. Oh, now we have Lord of the Rings. I think this is it Arathorn, the King of the Elves? Classic facial meme here, where you're looking at the vital signs as a CRNA and you're seeing the 90% SpO2 and the heart rate at 107, and you're definitely concerned, and you're looking at it carefully, and then the blood pressure drops to 71/35. Now you're really concerned and jumping to do something, and then you're seeing what looks like VTAC, and now your mouth is open. And then the joke at the end here is that he only gets extremely upset once he gets no cell phone service on his phone in the OR room. Joking that CRNAs or physician anesthesiologists are always on our cell phones during cases, behind the drapes. Once we get the patient intubated and sedated and everything, then we get on our phones and mess around. This next guy, I wonder who this guy is, because for, I don't know, maybe a decade now, he has been memed so much. He's saying general anesthesia is weird. It's like traveling ahead through time. And that cracks me up, because patients do constantly. They'll go to sleep, you'll induce them, you do the procedure, 6 hours may even pass, but then when the patient wakes back up, they're always like, oh, are you done already? Like to them, 1 second passed. Like the last thing that they remember is you were talking to them, telling them they're about to go to sleep. So literally, hours and hours of time passes for the patient, but to their perception, no time passed at all. So it's always rewarding for me whenever a patient's like, oh, I feel great. Did we even get started? And I'm like, yeah, you're completely been cut open and gutted and then re-sewed back together. So I'm glad that you're feeling so good and so pleasant that you're just wondering if we even started surgery yet. Oh, happy holidays, CVICU nurses. Love anesthesia services. So this is referencing how especially for like cabbages, which coronary artery bypass graft, which is like open heart surgery, or valve replacements, anything like that, when the surgery's over, you have to take them to the CVICU to be monitored. And after those kind of procedures, you're gonna have central lines and PA catheters and pacing wires probably inserted and all kinds of stuff. And it all culminates into a whole tangled mess of multiple drips and things that we use during anesthesia. And we take a lot of that with us to CVICU for them to have in case they need it. And I definitely remember a ton of jumbled messes, because rolling the patient and getting them onto the bed from the OR table and trying to keep all of these, lines and things tight and close to the patient, and it just gets tangled. I mean, the best you can do, but it's going to get tangled, and so the CVICU nurses hate it. And I also remember being a CVICU nurse and receiving these patients and knowing it was going to take me like 2 hours to organize all these lines and to get everything situated. So trust me, most CRNAs, we feel your pain. We remember those moments. We're not trying to tangle it on purpose, guys. It just happens. Oh, it's another time delay one that I talked about earlier. This one's the Joker meme. He says, room delay, patient delay, nurse delay, surgeon delay, no problems. But anesthesia delay, and everyone loses their minds. And I know sometimes anesthesia, we're like self-proclaimed martyrs or something, that we just always get picked on, and everyone else is fine if other things get delayed, but if we delay it for some reason, it's a huge ordeal. Sometimes that is true. Sometimes when anesthesia, in the rare opportunity or rare time that we delay for some reason, it does feel like everybody makes a huge deal out of it. Oh yeah, I love this one. It's walking out of the hospital early because no extra cases moved to your room. And this is talking about how, like, when you're in the when you go into the OR first thing in the morning, or even sometimes the night before, you'll get an email letting you know what cases you're doing the next day. A lot of times one anesthesia provider will be assigned to like one room. So like, say I'm going to be in OR 4 tomorrow. So that means I'm going to have to handle all the OR cases that come into OR room 4, usually throughout the day. But what happens if all of your cases get done at like 12 o'clock or 1 p.m. or something, and there's no extra cases to be done and nobody really needs your help? A lot of times in anesthesia, you just get to go home, and usually you get paid like you were still there, even though you went home early, because there was nothing for you to do there. So yeah, in anesthesia, you're always like, yes, as soon as your cases get done and things happen and you get out of there early, that's a good day. Ron Swanson, classic. I love Parks and Rec. He's so funny. This meme's funny too. It says, nurse, I'm sorry. The nurse is speaking, saying, I'm sorry, but you can't just give IV sedation on the ward. And then Ron Swanson saying, not to worry, I have a permit. And the permit says, I can do what I want, anesthetist. And that is true to life, because a lot of times RNs, nurses on the floor, they have a lot of protocols and they're trained to follow those protocols. And I was an RN too. I understand that completely. Your license and scope of practice is only so much, so you can't just do whatever you want. You have to do things within certain protocols. So this is funny though, because as an anesthesia provider, your scope of practice you are allowed to kind of give medications if you see fit, and you can sedate on the floor. I mean, as long as you're doing appropriate monitoring. Of course, anything you do, you're now held responsible for. So if something goes wrong, now you're held responsible for what happened in that situation. But usually, if you're giving something on the floor, you need to sedate for some reason. You're doing it because your clinical judgment tells you it's appropriate. So in those cases, it is funny, because you say, like, I can do this because I am a CRNA or a physician anesthesiologist, so I can. Oh, the talk show, the trashy talk show memes. You claimed you had no medical history. Your prescriptions for metoprolol, lithium, albuterol, metformin, hydrocodone, Crestor, Seroquel, Lipitor, and Coumadin determined that was a lie. That is a constant struggle for us in anesthesia. You come into pre-op to talk to a patient before surgery. Maybe surgery's going to happen in like an hour, and you're doing one last comb through their medical history, and they're saying, oh yeah, I'm totally fine, no health history, I'm fine, or maybe I have a little high blood pressure or something like that. And you look at all their med list and you realize you've got probably like 10 diagnoses here if you're on these medications. And so you're having to really heavily investigate. And of course, a lot of these medications, like Coumadin especially, would really be concerning to you if you were going to be bleeding or anything like that. You need to be checking INRs. If patients weren't telling you about that, if they're on lithium and metoprolol, Seroquel, those are other concerning meds, whether they be antipsychotics or beta blockers that could affect the heart rate during the procedure. Those are all big things that you definitely should know about, and definitely means you have some medical history. So always tell anesthesia any med you're on and any legitimate medical history that you have. Now, recently I started doing OB. Recently is in like last October, so that was 5 months ago. And you very quickly realize the typical trends of what happens in OB. And this meme cracks me up with Willy Wonka saying, oh, you have an all-natural birth plan? Let me know when to call anesthesia. Now that's a little snarky, and you ladies who do the natural birth, I definitely have had patients do all natural, and that's amazing, and it definitely can happen. But there is quite a few who plan when they come in, especially if it's their first baby and they don't know what's coming ahead, what labor is going to really feel like. They come in with the idea of all natural, and then you get the phone call at 2 in the morning, like, I need you right now, and they're screaming in pain, and they're desperate for anesthesia to hurry and get there with an epidural. So sometimes anesthesia does kind of look at them and say, okay, let me know when you need me. Oh, the nurse anesthesia school meme. It says, I start nurse anesthesia school tomorrow, and the penguin's running one way, and then its other body's running the other way saying, I start nurse anesthesia school tomorrow. And it just is such a true meme here, because when you're starting anesthesia school, you are so just head going in all the different directions. You're so nervous, you're thinking about everything that you're gonna have to do. You're so excited. You're literally like a chicken with its head cut off running around. Another meme talking about the relationship between anesthesia and surgeons. I swear we love each other and we get along most of the time, but this is talking about when the surgeon's trying to rush you, so you pre-oxygenate for 10 minutes. And the guy saying, my style, you can call it the art of fighting without fighting. Anesthesia has that down to an art form. We know how to fight without fighting. And that's just, it's like taught to you day one of anesthesia school. And the joke is, you really don't need to pre-oxygenate more than like 2 minutes. So to pre-oxygenate for 10 minutes means you're unnecessarily delaying things, and you're doing it passive aggressively. So just, I guess, to get on the surgeon's nerves and delay them even more. I would not do that. I think that's very petty, but it's a funny meme. Oh, the classic joke that anesthesia is always, they obey the ABCs of anesthesia, which is airway, breathing, chair. That's another one taught to you day one of anesthesia school, is that that everyone is gonna consider you are there for the airway, breathing, and then chair. And I mean, I do like my chair. An SRNA meme, student registered nurse anesthetist meme. It says, you is broke, you is tired, you is a nurse anesthesia student. And that is extremely true. Another surgeon meme. So this is like Michael Myers, and he's like staring at you with this psychopathic look, from behind a bush, and it's saying how the surgeon be looking at you during turnovers. And that's true. Yeah, like the surgeon's job is to do their portion of the surgical procedure, and then they leave, and then the whole waking the patient up, getting them to the recovery room, making sure they're safe and airways patent and that they're not vomiting, nothing's wrong with them. Then you go see the next patient online for the next surgery, make sure they're appropriate to be done. Sometimes they're not totally appropriate. Sometimes they may have eaten something, or they may have an EKG abnormality that's suddenly shown up, or something may happen, and it's always anesthesia's responsibility to handle that before they go back for surgery, which would be unsafe. So anyway, the surgeon a lot of times is just kind of chilling in between this time, not really sure what's taking so long, or not really having anything they can be doing. So they can kind of be glaring at you from down the hall, wondering why you're taking so long, or why you haven't got the patient already asleep in the room and then ready to cut and do their work again. So another kind of accurate but a little exaggerated meme. Well, all right, guys, that was me looking at some internet memes on anesthesia. I hope you enjoyed it. They were very funny memes. Sometimes we're a little too serious and we don't know how to just take a joke. If you're not already a subscriber, make sure and hit that subscribe button and hit the like button and share it with your friends so we can continue to grow this community. Go over to Bolt CRNA on Instagram and follow me over there. I do usually daily story updates, and I try and engage with you guys over there. So if you want to keep up with my day-to-day, what's going on, what my life is like at the hospital, things like that, I talk about that more over there. And let me know in the comments below what your favorite anesthesia or medical meme is. All right, that's Bolt out. See you next time.